Friends, let's talk about something incredibly personal, often unspoken, and surprisingly critical to your well-being, especially if you're a man over 60. Many of you are navigating the beautiful, complex landscape of senior life, embracing wisdom, perhaps newfound freedoms, and yet there's a significant aspect of your health that remains shrouded in silence, even secrecy. I'm talking about masturbation. Yes, I know. It's a topic that might make some uncomfortable, a subject often dismissed as a young man's game, or perhaps for older gentlemen, something you've long since stopped thinking about, or even worse, something you feel guilt or shame about. But here's the shocking truth. A surprising number of men, over 60, are making silent, seemingly harmless mistakes in this private realm that are, without them even realizing it, slowly but surely undermining their physical and emotional health. These aren't just minor missteps. They're subtle erosions of well-being that can lead to discomfort, anxiety, and even prevent you from living your fullest, most vibrant senior life. I'm Dr. John from Senior Health Secrets, and for years I've dedicated my practice to illuminating the often overlooked corners of senior health, bringing compassionate, evidence-based insights directly to you. In this video, I'm going to pull back the curtain on these very specific, rarely discussed masturbation mistakes that men over 60 are making. More importantly, I'm not just here to highlight problems. I'm here to offer genuinely simple, effective, and actionable solutions, insights you won't find openly discussed elsewhere, that can transform this private act from a potential detriment into a powerful tool for your health, comfort, and profound peace of mind. So, if you've ever wondered about this aspect of your health, or if you simply want to ensure you're doing everything possible to safeguard your well-being as you age, then this video is an absolute must-watch, and I urge you to stay with me until the very end, because what you learn here could genuinely change how you experience your senior years. Hello, and welcome back to Senior Health Secrets. I'm Dr. John. Today we're diving into a topic that, while deeply personal, is incredibly important for the holistic health and well-being of men over 60, understanding and optimizing your approach to self-pleasure. It's a natural human experience, and acknowledging its role in our lives, even as we age, is a step towards greater self-awareness and improved health. If you find value in this open and honest discussion, please do consider giving this video a like, sharing it with someone you believe could benefit from this crucial information, and of course, subscribing to the Senior Health Secrets channel. Your engagement helps us bring more vital, often overlooked health topics to light, and I genuinely encourage you to comment below with any thoughts or questions you might have. Your experiences are valuable. Now, let's get straight into the heart of the matter and explore these often unseen masturbation mistakes that could be silently impacting your health. One of the most common, yet least discussed masturbation mistakes men over 60 often make stems from issues of frequency, lubrication, or technique. As we age, our bodies change, and what worked in our younger years might no longer be optimal, or could even become detrimental. Many men either engage in self-pleasure with excessive frequency, not realizing that their body's recovery time has slowed, or they use insufficient lubrication, leading to unnecessary friction and irritation. Others might maintain an overly vigorous technique they've used for decades, unaware that the delicate tissues of the penis and urethra become more fragile with age. Think of your body like a finely tuned instrument that requires specific care as it matures. You wouldn't play a vintage violin with the same aggressive force you might a newer, more robust one. The consequences of these habits can be subtle at first: minor discomfort, a persistent dull ache, or a lingering sense of irritation. Over time, however, these seemingly minor issues can escalate, potentially leading to microtears in the penile tissue, urethral irritation, or even contributing to inflammation in the pelvic region. While masturbation itself is not a direct cause of prostate cancer, chronic irritation or inflammation in the surrounding areas can certainly exacerbate existing prostate conditions or contribute to general discomfort and urinary issues. It's about recognizing that the elasticity of your skin, the thickness of your tissues, and your body's overall healing capacity naturally diminish with age. Pushing your body beyond its current limits or neglecting its evolving needs can turn a healthy, natural act into a source of silent physical strain that detracts from your overall comfort and well-being. It's crucial to remember that the goal here isn't to limit a natural and healthy part of life, but rather to adapt your approach to ensure it continues to be a source of pleasure and relaxation rather than an unacknowledged physical burden. This isn't about denying yourself. It's about understanding and respecting your aging body to ensure longevity of pleasure and health. Beyond the physical, another significant yet often insidious mistake older men can make regarding masturbation revolves around the heavy burdens of guilt and shame. For generations, societal norms and cultural messages have often portrayed masturbation as something illicit, immature, or even dirty, particularly for older individuals. These deeply ingrained perceptions don't magically disappear at 60. Many men carry this internalized judgment, leading them to feel embarrassed, anxious, or even morally wrong about engaging in self-pleasure. This isn't just a minor emotional hiccup. It's a profound internal conflict that can silently erode your mental and emotional well-being. When a natural human urge is met with self-condemnation, the act intended for release and relaxation becomes a source of stress. Instead of enjoying a moment of private pleasure, it's tainted by feelings of unworthiness or secrecy. This constant internal battle can manifest as increased anxiety, a diminished sense of self-worth, and even a withdrawal from other forms of intimacy or social connection, simply because the underlying shame makes one feel inherently less than. We live in a world where open discussions about sexuality, especially in later life, are still remarkably rare, leading to a vacuum where misinformation and outdated beliefs thrive. The truth is, self-pleasure is a normal, healthy, and often beneficial aspect of human sexuality at any age, offering physiological release, stress reduction, and an important avenue for self-discovery and body awareness. To deny this, or to wrap it in a shroud of shame, is to deny a part of your authentic self, and to miss out on the potential benefits that come from a healthy, unburdened relationship with your own body and desires. Recognizing and dismantling this internalized shame is not just about masturbation. It's about reclaiming your autonomy, embracing your sexuality, and fostering a healthier, more compassionate relationship with yourself in your golden years. Another critical mistake many men over 60 inadvertently make is using masturbation in a way that allows them to neglect or ignore underlying sexual health indicators. While self-pleasure is a private act, it also offers a unique opportunity for self-assessment. However, for some, it can become a coping mechanism, a way to avoid confronting uncomfortable truths about their changing bodies or emerging health issues. Perhaps you've noticed a persistent dull ache, a change in sensation, difficulty achieving or maintaining an erection, or unusual discomfort during or after masturbation. It's easy to dismiss these subtle shifts, to attribute them to just getting older, or to simply power through them hoping they'll resolve on their own. But these aren't just minor inconveniences. They can be your body's way of sending you important signals. For example, erectile dysfunction isn't merely a sexual issue. It can often be an early warning sign of underlying cardiovascular problems, diabetes, or even neurological conditions. Similarly, persistent pain or discomfort in the pelvic region could indicate prostate issues, urinary tract infections, or other inflammatory conditions that require medical attention. By ignoring these signs, or by using masturbation as a substitute for seeking professional medical advice, you risk delaying diagnosis and treatment for potentially serious health concerns. This isn't about creating alarm, but about fostering a mindset of proactive health management. Just as you wouldn't ignore persistent chest pain or unexplained fatigue, you shouldn't overlook changes in your sexual health. Your body is a complex system, and often issues in one area can be symptomatic of broader health challenges. A healthy approach involves acknowledging these changes, understanding their potential implications, and consulting with your healthcare provider. This ensures that masturbation remains a safe and enjoyable activity, and more importantly, that you're not missing crucial opportunities to safeguard your overall health and well-being as you age. Finally, let's address a more subtle yet profoundly impactful mistake: the tendency for masturbation to inadvertently become a substitute for genuine intimacy and connection, potentially leading to a sense of isolation. For many men over 60, life can bring significant changes in relationships, whether due to loss of a partner, geographical distance from family, or simply evolving social circles. In this landscape, masturbation remains a consistent, accessible form of sexual expression. While this is inherently healthy and vital for many, a potential pitfall arises when it becomes the sole outlet for sexual and even emotional needs, sometimes to the exclusion of seeking or nurturing partnered intimacy or broader social connections. It's not that masturbation itself causes isolation. Rather, an over-reliance on it as the primary or only form of sexual or emotional release can inadvertently reduce the motivation to seek out or invest in the complexities and vulnerabilities of shared intimacy. This can lead to a gradual withdrawal, a sense of unfulfilled relational needs, and a deeper feeling of loneliness, even if the physical aspect of sexuality is being addressed. Human beings are wired for connection. And while physical pleasure is a part of that emotional intimacy, shared experiences and genuine companionship contribute profoundly to our overall well-being and longevity. If masturbation becomes a comfortable island where all sexual and emotional expression resides, it can subtly reinforce a pattern of isolation, rather than encouraging the pursuit of enriching social and intimate bonds. It's about finding a balance. Self-pleasure is a vital component of a healthy sexual life, but it thrives best when it coexists within a broader framework of human connection. Neglecting opportunities for shared intimacy, whether romantic, platonic, or familial, in favor of a solitary sexual routine can ultimately leave a void in other crucial areas of your life, impacting your mental health, sense of belonging, and overall life satisfaction. Now that we've openly discussed these often overlooked mistakes, let's shift our focus from identifying potential issues to embracing powerful, practical solutions. The goal here isn't to restrict or judge, but to empower you with knowledge so you can transform your self-pleasure practices into a truly positive and beneficial aspect of your senior health journey. It's about being mindful, being kind to your body, and recognizing that your well-being in all its forms is paramount. Firstly, addressing the physical strain from too much, too little, or too hard is often about simple adjustments. Prioritize lubrication as we age. Natural lubrication can decrease. Don't hesitate to use a high-quality, body-safe lubricant. This isn't a sign of weakness. It's a smart, self-caring choice that prevents friction, discomfort, and potential irritation or micro-tears. Experiment to find what works best for you. Secondly, moderate frequency and intensity. Listen to your body. If you're experiencing soreness, discomfort, or a lingering ache, it's a clear signal to scale back on either frequency or vigor. Your body's recovery time is longer now, and a gentler, more mindful approach can lead to greater, more sustained pleasure without the physical toll. Think quality over quantity, and always prioritize comfort. Next, conquering the guilt and shame associated with self-pleasure requires a conscious shift in mindset. You are not alone in these feelings. Societal pressures have ingrained them for too long. However, it's time to reframe your perspective. Understand that self-pleasure is a natural, healthy, and legitimate part of human sexuality throughout life. It can be a source of stress, relief, comfort, and an important way to maintain sexual function. Challenge those internalized negative messages. Remind yourself that there is no shame in understanding and fulfilling your own needs. Embrace self-compassion and recognize that a healthy relationship with your own body and desires is fundamental to your overall mental well-being. This liberation from guilt can profoundly enhance not just your private moments, but your overall outlook on life. Regarding the mistake of neglecting sexual health indicators, the solution is proactive engagement with your health. Pay attention to your body's signals. Any persistent pain, discomfort, significant changes in erectile function, or unusual symptoms during or after masturbation should not be ignored. These are not signs of something to be ashamed of. They are invitations to understand what's happening within your body. Consult your doctor. Regular checkups are vital, and don't shy away from discussing sexual health concerns with your healthcare provider. They are professionals trained to help, and these discussions can uncover underlying issues that might be easily treatable or indicators of more significant health conditions that require prompt attention. Being proactive here is a gift you give yourself, ensuring minor issues don't become major problems. Finally, to counter the isolation and lack of connection. It's about consciously broadening your definition of intimacy and connection. While masturbation is a valid form of sexual expression, it doesn't have to be your only form of intimacy. Seek out connections. This could mean nurturing existing relationships, exploring new friendships, or even seeking a new romantic partnership if that feels right for you. Intimacy takes many forms: emotional sharing, shared activities, or simply being present with others. Balance solo pleasure with relational pursuits. Don't let the comfort and accessibility of masturbation deter you from the enriching, albeit sometimes challenging path of shared human connection. Your overall well-being is deeply intertwined with your sense of belonging and your ability to connect with others, both emotionally and, if desired, physically. By incorporating these simple yet profound changes into your approach, you can transform these potential mistakes into powerful pathways to greater health, comfort, and peace of mind. Imagine feeling more physically comfortable, free from guilt, empowered by knowledge about your body, and deeply connected to life and others. This isn't just about masturbation. It's about reclaiming agency over your entire well-being. You deserve to live a full, vibrant, and healthy life in every aspect, including your sexuality as you age. This journey is about self-awareness, self-compassion, and proactive health. Take these steps today. Begin with just one small change that resonates with you. Perhaps it's simply trying a new lubricant, or allowing yourself to feel less shame, or scheduling that long-overdue doctor's appointment. These small actions accumulate into significant improvements in your quality of life. You are valuable, your health matters, and embracing all aspects of your well-being will empower you to live your senior years to the absolute fullest. In closing, remember that understanding and addressing these often unspoken masturbation mistakes isn't about judgment, it's about empowerment. By shedding light on common physical, emotional, and relational pitfalls, we can transform a private act into a conscious practice that genuinely enhances your health and well-being as a man over 60. You have the power to embrace self-awareness, challenge outdated beliefs, and proactively manage your body's needs. If this video has helped you uncover a new path forward in understanding your sexual health, please type "enlightened" in the comments below, and don't forget to subscribe to Senior Health Secrets for more vital insights like these. Here's to a future of vibrant, informed, and truly holistic senior health.